In hospice, we're really intertwined and connected with the community since it's where we provide the bulk of our care. And we're trying to meet the patients and families wherever they are, which can mean in a physical sense like their home or extended care facility or even the hospital. And it can mean an emotional and spiritual sense to provide support to them. It can also mean wherever they are in their disease process, whether it's a new diagnosis or if it's been a chronic, long-standing illness that's starting to come to the end. In December of 2015, we were actually faced with the challenge of how do we provide the type of care we want to when we physically can't be there for the family and patient. The St. Louis area had been hit very hard with rain, which resulted in flooding throughout our service area. We were lucky in the fact that it only impacted 5 of our patients in 4 different locations, but one of those patients was actually in the last hours to days of her life, and we still wanted to be able to provide that support to her and her family. So Crystal, her nurse, actually tried just about everything she could to try to reach the patient. She started her drive and found that the road she needed to get to her was flooded, and she spoke with the son, who had an alternate route that he could take her on. But when he started his drive, he also found that his access was blocked by flooding. So she wasn't going to be able to physically get to the patient. But she spent the next hour and a half to 2 hours on the phone with the son and other family members, reviewing what to expect in the last stages of life, reviewing medication, providing the emotional support that they needed, and just the basics of how to keep her comfortable as her time was coming to an end. The patient did end up passing shortly into the evening, and we still weren't going to be able to get to her, but our chaplain, Anna, was on call and was able to continue that support to the family and make the necessary phone calls that we usually make. She was also able to coordinate with the neighbor on how to get the patient and family out of the house since they were still surrounded by floodwaters. And the neighbor actually helped contact the local fire department, and they were able to bring a boat in and evacuate the patient who had passed and also the family and evacuate them to safety. So while we weren't able to physically be there for them to provide that support, I think that we did an excellent job at providing the kind of compassionate care that we want to provide to our families at that time.